No heart. That's the situation facing Melbourne mother of two, Vicki Derderian. In 2020, Vicki's heart failed, and ever since she's been living with a VAD, a battery-operated life support device that mechanically pumps blood around her body. And what Vicki needs is a heart transplant, but she can't get her name on the list because of COVID vaccine mandates, even though she has a legal exemption from the jab.
Vicki and her husband John join us now live in Melbourne, along with today medical expert Dr Nick Coatsworth, who is live in Canberra. Vicki, let's come to you first. Now, obviously our hearts go out to you. How can you explain how you found yourself in this situation and what life is like for you day to day?
Yeah, back in 2020 I had a very severe heart failure, which at the time it pretty much my organs started shutting down. So I wasn't ready for a transplant back then. So the only choice for me at that time was to go on Ventricular Assist Device, which is a mechanical pump that pumps blood throughout the body, because my heart couldn't. And in order for me to do that, I had to undergo a very difficult procedure, because these machines are inserted surgically. I was in intensive care for 1.5 months. I was on life support because I couldn't breathe. After being discharged from intensive care, I spent another 3 months in hospital and also rehabilitation.
I had to learn. Sorry, Vicki. I don't know how you're still alive. And the other thing is, you like, all power to you for having the spirit to keep living. You haven't had the COVID vaccine. You decided not to get it because of complications.
Well, for me, I'm not I need to make this clear. I'm not an anti-vaxxer. I have taken all the necessary vaccinations to be as my workup towards heart transplant. But when it came to COVID-19, reading up on all the information and also knowing about my condition, I wanted to minimise risk as much as possible, because, as you know, heart transplant is not a walk in the park operation. It's very complicated and it has a lot of risks. And to face those risks on top of an unknown risk from a vaccination that has had partial approval, I had to think twice, and it's a very hard decision. I don't sit.
Sorry, Vicki. I completely get what you're saying, but does that prevent you in Victoria at the moment from getting life-saving surgery? Explain that to the audience.
That's right. The hospital stance at the moment is no jab, no heart, and it's been. I am ready to be on the heart transplant list, because medically I'm stable to be on it. But unfortunately, because of these mandates, it has interfered with patient-doctor relationship. Patients like myself, we are being pushed in a corner and coerced to take something that goes against what we believe in, or not receive life-saving treatment. And also for doctors as well, they are forced to implement this on their patients, otherwise they'll lose their jobs. So today I have utmost highest respect for all my treating team at the Alfred Hospital.
It is a difficult one, isn't it? Because this is the thing, these are rules that are in place in hospitals to keep patients safe. Dr Coatsworth, if we can bring you in now. Now, these vaccine rules are in place for a reason. Can you explain to us why?
Well, I'll talk to Vicki and John. Vicki and John, it's an incredible story that you've gone through over the past 3 years, and you're obviously an incredibly strong woman to get through that. You've highlighted how important.
Through my Lord. That's how I get my strength.
And I think faith is such an important thing here. But the other thing that's sacred, of course, Vicki, is the sacred donation of the organ by the organ donor and their family. And from a transplant physician's point of view, and I'm an infectious disease physician, I've looked after lots of people with transplants. I've had friends and patients of mine die of infectious complications after transplant, and COVID-19 is one of those complications. I agree with you when we talk about risk, but from the transplant physician's point of view, the biggest risk to you is when we hit your immune system like that. If you get COVID-19 without having the vaccine, then there's a really significant risk that you'll die, and that organ will die with you. And we don't want that to happen to you, and we certainly don't want it to happen to the family who's made that sacred donation. So it's such a complex area. I don't envy your decision, but I do stand by the rules that the transplant physicians have made here.
So Nick, are doctors now deciding not to treat someone because of the chance of getting COVID-19 in a hospital? Are we stopping treating people now?
On the contrary, Karl, this is an active treatment decision by the medical community. This hasn't changed during COVID-19. We knew that this was such a problem, COVID-19, for transplant recipients, that before the vaccine we actually stopped transplants in a lot of cases. So we do think, I know there's a lot of greys in COVID-19, Karl, a lot of greys. You and I discussed them last week on this show, but this is black and white. Unfortunately, we have to try and convince people like Vicki and John. We've got to do our best to convince them, but if we fail, ultimately that means that the organ isn't transplanted.
Is there going to be any movement in this for Vicki's sake? Can you talk to her?
I think the only chance of there being movement if there was a equally effective post-vaccine antibody type treatment, perhaps, that you could inject afterwards. But even then, I think I know my transplant colleagues relatively well. I think they'd want you to get the best care. And I know that there's a risk from the COVID-19 vaccine. It's a very, very small risk compared to everything that you've been through so far with the VAD going in, ICU after the transplant. All of those risks are actually higher than the COVID-19 risk. I know you've heard this before because the guys at the Alfred would have said it. But, from my heart, I hope that you'll be able to, work with them and perhaps receive that vaccine. If I was in your position, I'd receive it because I think it's the safest thing to do. And I know you don't agree with me, and I respect that decision, but please reconsider.
OK, we're discussing it. Just really quickly, Vicki.
With all due respect, in terms of risk, I'm at more higher risk of something from complication from VADS than than any other one.
Okay.
And also in terms of treatments, there are therapeutic treatments that is available to treat COVID. Should I have COVID.
All right, Vicki, we've got to go now. I'm really sorry. John, you didn't say a single word there, but we look forward to getting you two back because it's not over, this story, and it's a debate that's going on around the country, particularly Victoria at the moment. It's an interesting one. Nick, we'll talk to you soon too.
Hey there, Today fans. Sarah and...
What's my name again?
Oh my goodness, Karl.
Hey, thanks for watching our YouTube channel, though. Subscribe now for more news, special reports and amazing Aussie stories.
And Karl misbehaving,
Whoa,
of course.
That never happens.
Always happens.
What's she talking about?